Thanks to the amazing generosity of many people, Klara and I were able to travel from snowy Slovakia to sunny Rimini, Italy in February 2026 for surgery, where doctors used the selective percutaneous myofascial lengthening approach to free her legs so she could move better. Klara is 9 years old and has had cerebral palsy since birth. We asked Dr. Lampasi, who operated on Klara, to tell us more about the specifics, benefits and potential risks of SPML. What are the main indicators that a child with mobility issues could benefit from SPML surgery, and at what age is it most effective?
Main indications for SPML are contractures and tightness of lower limbs with reduced range of motion in hips, knees and ankles. The procedures can be performed both in children and adults, but it is most effective for young children before the development of severe secondary skeletal changes.
How does SPML differ from traditional surgical approaches for muscle contractures, and what are its main advantages for children?
SPML differs from traditional surgical approaches as it is percutaneous, which means that the skin is not opened and the procedure is performed using a needle or a microblade. And it mainly addresses the fascia, that is the tissue covering the muscle, and not the tendons. Main advantages are minimal invasiveness and quick recovery.
What can parents realistically expect in terms of mobility improvement and recovery timeline after SPML procedure?
Well, it is difficult to generalize. We can say that good results can be achieved in terms of mobility, range of motion and posture. Much also depends on the severity level and initial conditions.
What does the rehabilitation process look like after surgery, and what role do parents play in their child's recovery?
The procedure includes the early initiation of rehabilitation, which is carried out intensively from the first postoperative days. Depending on the severity of the patient's involvement, exercises aim to maintain and improve the range of motion achieved with the intervention, and improve strength, endurance, control, posture and walking. Depending on the case, rehabilitation may use orthosis and braces. Family participation to the rehabilitation program is essential from the beginning.
Are there any specific risks or limitations parents should be aware of when considering SPML for their child?
SPML is an effective procedure when performed with the right indications and by expert hands. One of the main risks is performing excessive lengthening, resulting in muscle weakening. In addition, SPML is one of the surgical procedures available in centers that treat these patients. As long as greater deformities develop, like hip dislocation or crouch gait, SPML intervention may be supportive, but is not sufficient. For this reason, it is advisable to contact centers that have experience not only with SPML, but with all the procedures necessary for these patients.